Hello, my name is Dr. Elbridge Bills. I'm the founding partner of Alliance OBGYN. My partners, Clement Shao and Todd Bashik, and I are presenting a series of short informational videos regarding various topics in obstetrics and gynecology. This is mainly intended for our patients, but this information is certainly helpful to the general public. Each topic is discussed in broad terms and certainly not applicable to all patients. This is not meant as a substitute for a doctor-patient relationship. Obstetrics, physical activity. Exercise in pregnancy is good. Women who exercise have a shorter labor and are less likely to have a C-section. There are several general guidelines that should be followed. In the first trimester of pregnancy, you can do essentially anything you want short of sitting in a hot tub. You can take a warm shower or a warm bath, but if you are sweating from the heat of the water, then it's too hot. Sweating itself is fine. Even if you ran the Peachtree Road Race, unless you have heat stroke, if you were to take your temperature at the end, it would be around 99.5. However, if you sit in a 104-degree hot tub for 20 minutes and take your temperature, it's 102 to 103. In the second and third trimester, we don't want you to do anything that makes your body jar up and down. Running, jogging, low-impact aerobics are fine. Jumping jacks are not so good. Going across Lake Lanier on a houseboat is fine. Bouncing across on a jet ski, not a good idea. The other rule to live by is if it hurts when you do that, you don't do that. This applies to intercourse as well. As long as it is a normal, uncomplicated pregnancy, sex is safe in pregnancy. However, if it hurts when you do that, or if there's bleeding when you do that, you don't do that. If you have bleeding that persists to the next morning, or very heavy bleeding, you should call the office. Otherwise, this is not an emergency, and you do not need to call the office or the on-call physician. You shouldn't engage in activity that has a high risk of falling, such as skiing or horseback riding. In some books, you may read to keep your heart rate less than 140. This also falls under the category of if it hurts when you do that, you don't do that. As you get further along in gestation, the heart rate where you are exceeding your maximal heart rate and your cardiac output, that is the amount of blood that pumps out of your heart each minute, decreases. So if you are suddenly much more winded or fatigued than you would normally be doing the same activity, this is your body telling you to slow down. You may also read books that say you can't lift anything more than 10 to 25 pounds. You can lift anything you want in pregnancy. It does not hurt the baby. It hurts you. Frequently your lower back. This is what I refer to as the bowling ball effect of pregnancy. The ideal weight gain in pregnancy is 25 to 35 pounds above your ideal body weight. This is like walking around with 3 or 4 bowling balls strapped to your belly button. This hurts. There's added fatigue. Your back hurts. Your knees ache. You walk up a flight of stairs and you get short of breath. This is all normal. If you have access to a swimming pool, swimming is an excellent exercise in pregnancy. It's both mixed aerobic and anaerobic exercise, and the bowling balls I mentioned earlier, they float, and it takes the stress off your back. I hope this has been helpful in explaining any questions regarding physical activity in pregnancy.